My name is Ed Fisher, and I'm a psychologist and professor in the School of Public Health at the University of North Carolina at Chapel Hill. And it's my great pleasure to welcome you to this webinar this afternoon on a continuum of community engagement and research, reflections on power and control. We have a wonderful group of presenters today that I'm sure will provide really useful insights and thoughts about these. Just a little bit more about myself and the organizers. I have the pleasure of working with Pat Tang in Peers for Progress at the University of North Carolina, Chapel Hill. Pat has been organizing the logistics and the web aspects of this webinar, along with Daphne Watkins and Jamie Abelson at the University of Michigan. We work in the Community, Family, and Peer Support Core of the Michigan Center for Diabetes Translational Research that is sponsoring this webinar. And also sponsoring it is the Curtis Center for Health Equity Research and Training, headed by Daphne Watkins. The Michigan Center for Diabetes Translational Research is headed by Michelle Heisler and Gretchen Piot, just to give due credit all around. Eugenia Eng. Jeannie Eng is hosting and facilitating this webinar this afternoon. And Jeannie, I'm sure, is known to many of you for her enormous and long-standing contributions to community-based and community-based participatory research and work and activism across a wide variety of health areas. In our own work in peer support, we're especially thankful for her initial work on lay health advisors and for her articulating, very importantly, the notion of a continuum of peer support from volunteers to, for example, peer support specialists and community health workers. Jeannie has received multiple awards from the American Public Health Association and other groups. She's done work in the US, Cameroon, China, Lebanon, and a number of nations in Southeast Asia, Central America, Africa, and Eastern Europe. And this is sort of old home week in many respects for this group, because Jeannie, along with our other speakers, Barbara Israel and Amy Schulz from Michigan, along with their colleague Edith Parker at Iowa, have edited 2 editions of Methods for Community-Based Participatory Research for Health, which is a major text and volume in the field. So with that, I want to turn it over to Jeannie to introduce the rest of the group and encourage all of you that you're going to really find the next hour and a half very useful and stimulating. Thanks.
All right. Thank you, Ed. He's calling me a co-host, but it's really, it's very much of an honor for me. In my capacity, I'm really going to serve more as a moderator for this UNC-UM co-sponsored webinar. It's the latest in nearly 40-year history of exchange between our 2 states of North Carolina and Michigan, between our 2 universities, between our 2 schools of public health, among our faculty, our students, and especially our community partners. So I'm going to introduce each of the speakers and then turn the panel over. It will be interactive. There will not be, one person talking at a time, but there will be an exchange among the panelists. And we will go through that until about 2:25, 2:30, and then we'll open it up for questions and comments. And please put them in as they come to you in the Q&A. Okay, so first up, Laprisha Daniels. You want to wave, Laprisha? She holds a bachelor's degree in psychology from Michigan State University, as well as master's degrees in social work and public health from the University of Michigan. She has over 20 years of public health experience with 15 of those being in progressively responsible leadership roles, where she has been responsible for developing, implementing, and evaluating efforts focused on eliminating some of the most stubborn health disparities. She has held positions at top research institutions, including the University of Michigan, Johns Hopkins, where she served as a research project manager and director for community-based participatory research projects. She served as well as the Detroit Health Department's Director of Health Services, and provided oversight for programs including the Childhood Lead Poisoning Prevention Program, immunizations, hearing and vision, infant mortality prevention, and behavioral health. She's currently the Executive Director of Detroiters Working for Environmental Justice, where she is responsible for developing strategies that work to disrupt and dismantle the status quo that leads to Detroiters bearing the undue burden of environmental health hazards that ultimately impact their quality of lives. Next is Ricardo Guzman. Wave. Hi, Ricardo. He has more than 45 years of experience working in health and human service programs, focusing on the Southwest Detroit Hispanic communities. He has graduate degrees from Wayne State University School of Social Work and the University of Michigan School of Public Health. From 1983 to 2016, Ricardo served as Chief Executive Officer for the Community Health and Social Services Center, known as CHAS. It's a federally qualified health center organization in Detroit. The center provides a full range of culturally competent primary health care and social services to the residents of Detroit, with special emphasis on the underserved African American and Hispanic populations. During his tenure as CEO, Ricardo was successful in obtaining funding to plan and implement several major community-level interventions addressing diabetes, intimate partner violence, and chronic disease care services in Detroit. Through his involvement with the Detroit Urban Research Center, Ricardo serves as a leading advocate for a CBPR focused on community participation in the planning and implementation of health programs. In May 2012, he completed the development and construction of a new $17 million, 48,000 square feet award-winning health and wellness center to serve the residents in Southwest Detroit. Okay, now Amy Schulz. You can wave. Okay, so Amy is a university diversity and social transformation professor at the University of Michigan, as well as a professor in health behavior and health education at the University of Michigan School of Public Health. She served for 20 years as the principal investigator for the Healthy Environments Partnership, a community-based participatory research partnership focused on social and physical environments and cardiovascular disease in Detroit. And she currently serves as a multi-PI for Community Action to Promote Healthy Environments, which is again a CBPR partnership, but focused on improving air quality and reducing associated adverse health impacts in Detroit. She received her MPH in health behavior and health education, MSW in social policy, and PhD in sociology, all from the University of Michigan at Ann Arbor. Her current research focuses on understanding the cumulative impacts of physical environmental exposures in conjunction with community economic and social characteristics, and implications for health, and in designing community and policy interventions to promote environmental health and health equity in urban areas. Okay, finally, we have Barbara Israel. Barbara, I have to say, was born and raised in Greensboro, North Carolina. Okay. But she is a professor in the Department of Health Behavior and Health Education at the University of Michigan School of Public Health. She's director and founding member of the Detroit Community Academic Urban Research Center, a CBPR partnership now in its 28th year. The center has fostered and supported the establishment of numerous CBPR partnerships engaged in multiple basic etiologic research, intervention and policy research, and training projects aimed at increasing knowledge and addressing factors associated with the social determinants of health inequities. Barbara has extensive experience conducting, evaluating, disseminating, translating findings from a number of these CBPR partnerships and projects in collaboration with partners in diverse communities. These efforts have included, for example, the environmental triggers of childhood asthma, strategies for reducing them, social and physical environmental determinants of cardiovascular disease, the impact of physical activity interventions on heart health, the impact of air quality on health and strategies for mitigating the impact, and then translation of research findings into policy change and capacity building for conducting CBPR and policy advocacy. So they will now begin the panel, which they call a continuum of community engagement in research, reflections on power and control. All right.
All right. Thank you so much, Jeannie, for those lovely introductions. And again, I'm Amy Schulz, really excited and honored to be here with this amazing group of colleagues and to have an opportunity to talk a little bit about community engaged research and especially about issues of power and control as they are manifest within those contexts. I agreed to get us started today by talking just a little bit about community. So often the question gets asked, what is the definition of community? What do you mean when you talk about community? And I'm going to offer just a few comments about 3 ways. There are many, many ways that community is defined and understood. But I'm going to talk about 3 sort of general buckets or categories of ways that community sometimes gets thought about, particularly in public health and when we're thinking about interventions that might affect communities and community health. So one way that we often think about communities is as settings, as places where we find people who we might want to work with to try out an intervention and see how effective it is in promoting health or changes in health behaviors or that sort of thing. So this idea of community as a place where we find people who we might work with around health interventions. A second way that community sometimes gets conceptualized is to think about communities as contexts or places. And in that way of thinking about communities, sometimes we think about communities as places whose properties can be manipulated or changed in some way in order to try to promote health. A couple of examples there include interventions that really focus on how healthy the food is that people can access in a particular geographic area. So we can think about intervening to make sure that there are more fruits and vegetables available within a particular geographic context so that it's easier for people to act in ways that are health promoting. Similarly, thinking about the physical activity environment is another common way that we think about communities as contexts, and we can think about interventions that make it safer for people to be physically active, that make it so that there are walking areas that are separate from roadways, so there are fewer pedestrian car accidents, that sort of thing. So that's a second way that we often think about communities. And a third way that communities often get conceptualized in public health, and one that's particularly relevant for our conversation today, is this idea of communities as social systems, communities as aggregations or systems that include individuals and organizations and people and contexts and places. And thinking about communities as systems is really fundamental to thinking about community-based participatory research which is, I think, where we're going to focus our conversation today. Each of these ways of thinking about community has a certain set of assumptions, and if you're interested in measurement, they have different kinds of things we might be interested in measuring as researchers or understanding the phenomenon as they unfold. And a couple of assumptions when we think about communities as social systems, and that I think you're going to hear. I'm going to talk about these in kind of an abstract way right now, but I think as our conversation unfolds, we'll hear some more concrete examples of those. But a couple of assumptions, if we think about communities as systems, is that people exist within the context of those systems, and as individuals within those systems, we all have agency. And what that means is that we have things that we care about, we have projects that we're interested in moving forward, that things that have meaning that we care deeply about, and that we are all working on those agendas, whether they're personal agendas or collective agendas, within the context of these complex systems. And that those systems are dynamic, and that actions that any one of us take as individuals, or that organizations take, or as groups of us take within those systems, impact other aspects of the system. And the simple way of saying that is what I do affects you, and vice versa, if we're part of the same system. Systems are also unequal. And that's a lot of what we're going to be talking about today. So some groups and institutions have more power than others, and that's connected to our social positions, the kinds of resources that we have access to, and there are differences in the sources of power and the types of power that we have access to within those systems. So if we think about power as the ability to act and the ability to do something, there are many forms of power. They can be financial, they can be political, they can be personal, they can be collective, and that's just to name a few, right? So there's lots of different ways that power plays out within systems, and in general, those dynamics are unequal. In CBPR, we often think about inequities between academic institutions and communities. And that's kind of a broad way of thinking about. Those are real, they're important, and they affect our ability to develop what sometimes gets referred to as authentic community partnerships or authentic relationships. But it's also important to keep in mind that there are important inequities within communities. So between individuals, between groups, between organizations that are within a community system, there are also inequities. They often are organized around sort of the very familiar dimensions of race or class or gender and intersections of those identities or lines of power. And they come into play in really critical ways, not only in the creation of partnerships, but in the ways that those partnerships work together. And they are part and parcel of the ongoing work of thinking about how do we create more equitable systems that really allow us to be effective in working together to tackle the really challenging issues around, that drive the health inequities that we're all concerned with. So that's my little opening comments to set a little bit of a framework for the conversation that we're going to have today. And I am now going to invite the members of the panel to kick us off a little bit and invite a conversation. The first question that we agreed to start with as a panel is to just invite a conversation about what has been your experience with community research. And I think Ricardo and Laprisha were going to kick us off here, and then the rest of us will chime in along the way.
Sure, Laprisha, do you want me to go first, or? Okay, we had a struggle about that when we were preparing for that. So who's going first? Who's going first? Hola, everybody. I'm happy to be here. As they introduced me, I'm Ricardo Guzman, CEO Emeritus. I am retired, and as I heard in the past, I am a grandparent in training. So you all know where I'm coming from. I have to before we really get into things, we really need to set the stage a little bit, I don't want to say differently, but so that folks understand. We have been doing this, and I have been doing this with Barbara and Amy and the folks at the University of Michigan since the beginning, 28 years ago, 20, so whatever it is. And because of that, our experience really runs the gamut of, I didn't give a damn about you researchers. I didn't want to see you. I didn't like you because all I got from you was to take. You never gave back, et cetera, to the point where we're at now. And again, it didn't take quite 28 years, but to the point where we acknowledge and understand the roles of researchers. We acknowledge and understand the role of researchers in the academic community. And in particular, our understanding of the whole concept of publish or perish, and working with folks and understanding folks. So I guess I wanted to lay that out so that when we talk, some of this has so much to do with the continuum of trust that we've been able to develop over the years that has totally, impacted not only us personally, but our organizations, our communities, et cetera. I mean, just the things that have happened have been outstanding. So my original, as I said, my original interaction with researchers was simply, research driven. I would get a call in my office from somebody at the University of Michigan, at Michigan State, at Wayne State, at wherever. Hi, I'm so-and-so, I'm Dr. So-and-so, excuse me. And we've got this program and we would like to come in and, talk to your folks. Now, you need to understand that I ran a community health center that's seen a lot of folks, and we've been doing it for 53 years. And I was part of that group to pull that center together. So we have a data coming out of our ears. And I say that because I can see the researchers or hear the researchers salivating right now, thinking of all that information that they can use. And that's my point, is that it was always research driven, always take, and never give back. So that's been, that was our initial experience. And I'll turn it over to Laprisha.
Sure. So thank you for that. I think it's important to lay that foundation. And Ricardo's experience is very different than what my experience was coming into interacting with researchers, because as Jeannie mentioned, I was a research project manager. That is how I became involved in research. And the only research that I was involved in was community-based participatory research. So is there another way to do research? So that's sort of the lens that I look at research through, and didn't have sort of this tension that Ricardo is speaking about. But as a research project, so I was trained as a public health social worker. I was hired as a research project manager, but I also was from the community that was being engaged in the research. So it was sort of a dual role, and I sort of straddled the fence in a way that I was the community that was being studied, so to speak, and being approached and sometimes being entered into this relationship with, but also I was a university hire, right? So I was an employee of the university, I was a member of the community, and I was able to sort of be that bridge between the two. And so that was a very unique role, and at times felt tense. How much am I a community member? How much am I an employee and need to support the research goals, which are different than community goals often? How do I support the research timeline, which is different than the community timeline? When you have a 5-year NIH grant for $5 million, and you have certain outcomes and objectives that have to be met, and you're responsible for that as a researcher, or as a project manager, then that feels very different than being a community member that sees an opportunity for a pilot that can then become a program in your community that you would like to be sustained without the $5 million. And now perhaps a lot of times without the researcher being involved. And so that tension was often there, and working through that and thinking about how do you sustain programs. CBPR, URC, Ricardo mentioned, has been around for 28 years. And so, and a lot of the work I did was through projects that were part of the URC. And so there was a sense that this would be long-term, that this would be a pilot intervention, but there will be something left for the community. So beyond within this continuum that we speak about, there are different points at which the community is engaged, and more engaged in some parts than others, right? We don't expect that community members will be figuring out power analysis, not part of what they're going to do, but are they going to help to say, for your power analysis, for your power that you have to be interacting with certain folks. How do we best communicate with those folks? How do we best engage those folks in this process? And how do we make sure that we're returning something? And so my experience with CBPR and my experience with research has been that part, that give and take, moving as much as possible at the speed of trust with community, and making it clear to community that this is not a one and done, and that this is not a transactional, extractive relationship. So I will stop there.
Thanks so much, Laprisha and Ricardo. So we have one slide we want to share. And so Pat, if you're good to put that up now. And I think, again, thanks to Ricardo and Laprisha, who've already sort of set the stage for this. And this is a familiar continuum to many of the people, I'm sure, on this webinar, but want to use it to sort of set the stage for the remainder of our conversation, which is recognizing that there are many different ways and degrees to which researchers and communities can be involved in research, and building on the work of Karen Hatcher and others on this continuum, and thinking about it as a continuum. And want to acknowledge that these are all valid approaches to research, and that what we're trying to make is the point about the different levels of community involvement and how that plays out, particularly in terms of community-based participatory research, which we'll be focusing most of our comments on today. So really quickly, on the left-hand side of this continuum, which starts low, and on the right-hand side in bright red is high, and the dimensions we're looking at are issues like power and control, responsibility and ownership, participation, influence. To what extent is community involvement high? And that moves you over to the right-hand side of the continuum as compared to low, which is the left-hand side. And so the left-hand side, investigator-driven research, I would say most NIH-funded research is investigator-driven research. Much of what has contributed to a body of science and knowledge over the decades has been investigator-driven research, which again, though, in terms of community involvement is usually quite low on those dimensions of power, shared power and control, responsibility, etc. As you move to the right, we often hear the language community-placed or community-based research. And for the most part, the research that fits within this part of the continuum is physically based in a community. I sometimes hear people, depending on their training, they have a lab in the community as compared to a lab in their office. But again, so it's much more a geographic space to carry out your research, but not much community involvement. The community, moving further to the right, community engaged research, this is a little bit tricky because this language is being used more and more as an umbrella term for all types of community involvement. We still like to see it more in terms of, yes, there's some level of community involvement. There may be an advisory board, but it's often referred to it as an advisory board, advisory committee, where the advice may or may not be taken into consideration by the researchers. And again, recognizing within each of these, there's a continuum itself, if you will. But moving on to community-based participatory research is where, from our perspective and many others, where you start to really get into shared power and control, responsibility, participation, influence, things that we're going to be talking about today. How do you develop authentic, equitable, power-sharing partnerships in the context of community-based participatory research? But also important to acknowledge is further to the right of the continuum is community-driven research. Often research is carried out by community-based organizations or within the context of community-based organizations, perhaps without any academic involvement. The members of the CBO have their own team of researchers who carry out the research, or maybe they subcontract with the researcher to come in and evaluate a program or to come in and collect data. But the question and everything that's the focus has been community-driven, community-led. So most of the work of the Detroit Urban Research Center and affiliated partnerships has been community-based participatory research. We have also engaged in community-driven research, but just want to provide this context today for what we're going to be focusing on as we continue with different questions. So I'll turn it back to Jeannie to ask us the next question.
All right. Well, so.
And Pat, we can go back to, we don't need the slide anymore. Thank you.
So given that, I'd like to ask the panelists then to kind of tell us how you have gone about creating, as Amy referred to it, authentic partnerships where communities and academic researchers are collaborating. And in your example, if you could also address what were the power dynamics about how you had gone about creating authentic partnerships.
Laprisha, do you want to start?
Sure, Ricardo.
That was sneaky. I know. I apologize.
Speaking of power dynamics, I'm respecting my elders here, and yes, I will.
Thank you.
I will go first. So this is a really good question. There's so many layers to, and there's so it's there. I think about the little things that happen that really support real partnership that often go unconsidered. That the URC has gotten really good at doing, though, considering these little gestures. Having meetings in the community, considering barriers to community engagement. I actually got on late today. I'm in Detroit. I'm working from my office in Detroit, and we were having internet issues. We constantly have internet issues, and this is my office. I'm not at my home office. This is my office. And so considering things like digital divides, considering barriers to access like transportation, considering language barriers. And I don't mean language as English as a second language, as I mean that too, but also just plain language as a barrier to engaging community members. How you recruit community members that would be part of a steering committee or a community advisory board, or those that would be, research participants. I know there was an early study, it was a CBPR study, it was not part of the URC, but one of the ways that recruitment happened was at laundromats and grocery stores and, with the little flyer with the tear-offs, right? So how do you actually engage the community in a way that's letting them know that you want to be accessible and that this is a space for them is really, really important. I mentioned moving at the speed of trust. And that's something that I heard in this space a lot of times from community partners. And so recognizing that the research grant may be written in a way that's linear, but a lot of this work is going to be very iterative and very circular. I mentioned sometimes to Amy that she'll mention something and she's really, really collaborative. And every once in a while I'll say, okay, Amy, this might not be one of these times that this is up for discussion for everyone. And so there are, but we tend to err on the side of being very collaborative and very inclusive is really important. But part of it too is that it really just has to be authentic, right? You can't play. You can't fake authenticity. It really has to be an authentic partnership, and everyone has to be clear, and it has to be people have to be transparent and clear about why folks are at the table. And that has been the most important part. We might not all have the same exact goal, and that's okay. Ricardo mentioned publish or perish, and so that may not be the goal of the community that you publish, but if that really is a goal, then it's okay to put that forward and say, part of this has to do with, I am trying to publish, and this is the way that I would like you to engage in this process with me. And I can say as a community member, that's fine. And my goal here is to have a sustainable program. And how much can you publishing then support my goal, right? And so there has to be transparency, and we can't play with that. We can't act like this is an authentic relationship. Either it is or it isn't. And the community is really good about calling people out on BS. And so the level of engagement you're going to get is going to be directly correlated to how authentic that partnership really is from the onset. Ricardo?
Yeah, that was outstanding. Thank you, Laprisha. That's pretty much my position. You know, yeah, I don't have to say anything. The reality of it is that, you know, when we talk about CBPR, it's not all. Maybe it is what we have bought into, hook, line, and sinker. But it may not be for you. I mean, we need that issue of trust, that issue of being real, that's, one of the reasons why I got involved initially is that I did not know Barbara that well, Barbara Israel. I did not know Amy. I didn't know a lot of the people at the university, but I did know a few people who I'd worked with over time. Mm-hmm. And they came highly recommended by those folks. So I guess my point in this is the issue of trust, the issue of respect, and the issue that this is a marathon. Mm-hmm. This is not the 100 meters, race. This is a marathon that it's not just one program, it's just not one study. It is developing and creating this vehicle with interaction that includes compromise, that includes respecting each other for the long run. That issue of trust is, folks see through that. And it's at all layers. It's the trust between the community-based organizations and the university. It's the trust between the community folks that we're engaging with and community-based organizations, as well as the university. So that trust factor, if that is lost, you can pretty much fold up the tent and go on home, because nothing's gonna happen. Let me just say, the probability that any success is going to take place is probably very low. So I think that those are the key pieces of it, and that's where the URC has been extremely successful at, because 28 years later, we're all grayer. We all look a little older, not much though, but we've stuck together, and we become friends. We become colleagues. We become, hey, Barb, how are you doing? What's going on? What's happening? I don't have to have a reason to call outside of just to say hello. And it's important that you get that level. And if you don't want that level, then, I would seriously make sure that you might not want to participate in CBPR, because that's the kind of commitment that you have. And I think I would only close in, I would totally, without reservation, Barbara and Amy's piece of it's all about the power. It's all about power. And you either got it or you don't, or you're willing to share it. You're willing to compromise with it. And I think that that's one of the things that we've been extremely successful in doing.
So I do want to say something that, just circle back to something that Ricardo said. He mentioned that he was willing to engage with Barbara and Amy and others because there was a recommendation from another trusted individual. And part of, and it sort of ties into power as well, is that we're protective as community-based organizations.
Mm-hmm.
We're very protective of our community members. And we recognize that the university can be this very sort of powerful, right, organization, and can be overwhelming to the community. And we are trying to make sure that the power is not wielded in a way that can harm. And that's important to recognize, that the university sometimes thinks that it is approaching, that it is this great resource for the community. But the community is not looking at the university as that necessarily. And so recognizing what your reputation is in the community is really, really important. And that is something that I know from my work at the university, and now as the leader of a community-based organization that's engaged with this work, that the URC has done a really good job of changing that dynamic and that perspective that community members have of the University of Michigan to some extent. But recognizing what that reputation is coming in, and not thinking like, oh, the community is going to be so excited that we're arriving and we're going to do this awesome work. And so that's really important to recognize, that we're just protective, and we recognize the power, and that power can be abused in the community. And because there has been so much harm from so many different institutions in the communities that often are being engaged in research, then it's important to recognize that. And the question is then, how do you adjust based on recognizing those power dynamics, and that there's a risk for many folks of color, low-income communities, rural communities, indigenous communities, that there's a real risk of harm, and that's recognized by the community. And so it has to be recognized by the university as well.
I want to jump in here on that point, because I think, from an academic perspective, I appreciate the words that you guys are saying about the work that the URC has done. And yet, I think coming from an academic institution, there are, even as the work of thinking about equity and thinking about the impact of our actions in communities whose health we care about deeply. Sometimes, and I'll own this myself, sometimes I am oblivious to the ways that my actions may cause pain in communities, may adversely impact community partners. And the work in that arena is constant, and it's humbling. And I think you have to come to the table with a readiness to listen, to be checked, to be made aware of the ways that your actions may be impacting people. There's the old rubric of intent versus impact, right? I may not intend to have the impact that I'm having, but I need to be ready to hear it and to adjust accordingly, right? And so I really do think the work of creating equitable partnerships is constant. You're never there. You're never at a place where you can sit back on your laurels and say, okay, we've made it, right? It's a big undertaking. It's a really important undertaking. We really need to be doing this work. And I really appreciate, my partners who are willing to step up and say this is how this has impacted me, and let's have a conversation about this, right? Because those are the learning opportunities. Those are the places where we as people who are based in academic institutions need to be prepared to cede leadership to community partners and learn from what it is they're saying to us. So I think that those are really key pieces of this work that I just feel humbled by on a daily basis, and grateful to the partners that I have the opportunity to learn from and learn with in doing this work. I also have to just really quickly make a comment about language, because I almost laughed when Laprisha started talking about a power analysis. I mean, thinking about language and how the part of this process is creating a shared language, right? So from an academic perspective, we talk about a power analysis, and we often mean that in a statistical sense, right? But community partners who come from a community organizing perspective are going to use power analysis in a very different way, right? And so part of this is also just sort of, what is the language we're using, and how are we having a shared language around some of our work together? So
I'll just add one really quick point here, and I think it's been implicit in what we've been talking about, maybe just to make it explicit, which is just sharing, a large part of sharing power is sharing resources. And how do we start thinking about, or continue to think about, resources in multiple ways? I think first and foremost, it's about money. Maybe when we talk about resources, our community partners compensated for their time on steering committees, our community members compensated for their time participating in, different studies. But I think one of the things actually I've learned from our community partners is, how do we broaden out that understanding of resources? And for example, again, community partners have talked about the benefits of having access to student interns with the community-based organization, and that's a resource that the university can provide, and that can be valuable. And so access to publishing, while that may not be the first thing most community partners have been interested in, some folks have gotten engaged in that and or attending professional meetings. And co-presenting, because that's something that we feel very strongly about. So again, just trying to think about sharing leadership, Amy referred to before. That's another way of sharing power. And so being creative about, what is it that people can benefit from? How do we ensure mutual benefits when we're trying to achieve sharing power and resources? With that, I'll move us on. Still in this, in thinking about ways that you've shared power and what that process has looked like, I wonder if people could talk about what are some opportunities that arise when it works, when power is really shared. What does it look like? What can happen when those relationships work? And what happens when the relationships don't work and power isn't shared? And I'm thinking maybe Ricardo was going to start us off with an example where power wasn't shared in research. Are you good with that, Ricardo?
Yes, sure. I've got so many examples of that. It's like I got to pick one out of the hat here. I guess the first thing I would also say is that when we talk about power, and funding, et cetera, the funders also have to understand that you don't always have to go to the usual suspects. The health departments, there are community-based organizations that have significant influence in the community and access to the community. Both of our organizations here are great examples of that. I think that in saying that, it's I would leave the little point of it, and always have to go to the usual suspects that are out there, number one. I will give you one example of, we have had, and I have had multiple occasions where, people will come to us, and one of the key pieces that that needs to be clarified, not even clarified, but just stated, is that the idea of community-based participatory research is one in which the community has identified or will identify a particular issue that they really need to deal with, that they want somebody to help, to work with, etc. And it's not always, that's not the case usually. Usually the researcher is coming in with their own idea. This is what we want to do. This is where we want to go. And you've got all these people that you work with. And do you think we could recruit them to participate? And, my point in that, I just say that to put aside, is that we've had multiple occasions where people will come in like that. And we just sit down with them and say, look, I think your research piece is admirable, really support it, but it's not where we want it. That's not the direction we want to go. I've had researchers kind of look at me like, I got two heads and say, what do you mean? I'm here to help you. And it reminds me of we have worked with David Satcher on multiple occasions in the past. And David's great line of, I'm here to help you. I'm from the government. I'm here to help you kind of attitude. And it's that they would look at me as in, I'm here to, what's wrong with you? You should be accepting this, this invitation for us at the University of Michigan or Michigan State or where else at, to help you people, kind of attitude, and say, well, thanks a lot, but no thanks. We're not, we don't want to do that right now. That's not where our focus is going to be. Now, if you want to deal with diabetes, if you want to deal with sorry, I'm going blank right now, domestic violence and sexual assaults, those are programs. I'm saying this because it's the seed that was planted through CBPR. Those are the programs that at our center came out of the research the initial research we did in those first 5 or 6 years of participating with the URC. That is now part of the services that we provide. After we did what we did with the initial focus of that, we went out and got more, got other dollars, got other programs. But the value of that service was so impressive to the community, to the service, to the patients and the people that we see, that we said, no, this has got to be part of our core services now. So that's a real good example of, something where somebody's bringing something in that we're not, it may be a good idea, but that's not where we want to be. To something that we were able to plant that seed, grow that, and then now becomes part of the core services that we now, that we provide at the center.
So I'm more than happy to talk briefly about, I think the question was, how do you share power? And I feel like there are places that you can read, right? Like how to do that. So I'm wondering if it would be useful to say what it looks like when it's actually happening, because I don't know how much literature there is on that piece. So what it looks like is the researchers or university partners are not doing all the talking. You can tell, and not that, so I don't mean a shared facilitation of a meeting, because that's still saying you do this, I do this, you do this, I do this. But when there's opportunity for free-flowing conversation, do community members and community partners feel comfortable speaking up? And even to the point that I feel like, Barbara, you've been talking a lot, Amy, you've been talking a lot, I'm going to just jump in, right? Because I recognize that I can do that because the power is shared. I know that's acceptable. I know that I won't be, I'm comfortable enough to do that because of the relationship we have. So that's one of the ways it looks. It also looks like Ricardo said, I can just call Barbara, right? And also I call her Barbara, right? I don't call her Dr. Israel. So Ricardo made that point a little earlier when he said someone called from the university and say, I'm Dr. such and such, right? So we're already setting up a power dynamic of who's who, and I have this degree and this is how I should be regarded. So there's a familiarity and there's a level of comfort. And usually when there's someone wielding power, there's some fear, right? That's innate in that relationship. And so there's no presence of that. I'm very comfortable saying what I need to say to you directly as a sidebar or within a group. Very comfortable saying what I need to say and expressing my opinion and coming as my full self is when you can tell that the power is being shared beyond saying half the budget's going to be given to the community org and half the budget is going, right? That's a gesture to try to balance out some of that, but you can tell when power is really being shared and how the community members are interacting with university, how community-based organizations are interacting with university. So I wanted to get that out.
Nice. I wonder if now, Jeannie, if there's quite Q&A in the Q&As, if you want to start that, or we can go a little bit further.
Well, so far we have 5 questions in the Q&A. They're very interesting questions, but are there some final points you want to make?
Everybody good to move to the Q&A?
Yeah, I think the only couple points that I would make real quick is that, you know, one of the things that I think makes CBPR successful is this idea, and we talked a little bit about mentioning, is this is a continuous evaluation process. You know, we're we're at the beginning of this process, at the beginning of our journey here with the URC, is that we in the community, we're really tired of Barbara wanting this evaluation all the damn time. You know, I mean, so what a point, you know, and as you mature within the organization, you realize that that's what has kept us together. Evaluating, looking at, okay, this went well, this didn't go well. You know, with no blame. I mean, this is just, you know, it reinforces what it is that we're doing and how we're doing it. So I think that's a really important point. I think the only other one is that, and you know, Laprisha is a great example. This seed was planted in her, and it's flourished. You know, and you know, you can't ask for more than that. It is, you know, talk about outliers. This would have never happened 20 years ago, 15 years ago, 10 years ago, probably. You know, where we'd be sitting here talking with a researcher who is really a community member, who is, you know, I mean, it just has that perspective. You know, it was clearly delineated between the folks at the university or wherever else, but not part of the community, not part of the community at all. So I'll leave it at that.
Okay. All right, we just got number 6. Keep the questions coming in. I'm going to start with the one that just came in because it's so fundamental. Can the URC be described briefly? What is the URC?
Okay. Apologies, but I didn't know we would end up using that phrase so much. We should have started with that. So apologies to those. Again, the Detroit has this long name, the Detroit Community Academic Urban Research Center. We refer to it as the Detroit URC for short. It has been around since 1995, initially funded through CDC. And we're first and foremost a center that fosters, facilitates, promotes, supports the establishment of CBPR partnerships, and especially CBPR partnerships that address social determinants of health and try to address health inequities first and foremost in the city of Detroit, but we've been expanding and doing, we have national programs now. We do a lot of consulting and training around the country to help promote and foster CBPR. So we do a lot of capacity building work. And then the affiliated partnerships that we help get up and running are the ones that are really doing the CBPR project studies. So, for example, Amy referred to the Healthy Environments Partnership that was the PI for over 20 years. CAFE, which is working on air quality, that Amy's now the PI. Those are affiliated partnerships. They have their own steering committee, their own governing bodies, goals, objectives, funding streams, etc. But the Detroit URC has its board, which Ricardo was a member of for years. Laprisha is now a member of. So that's, but we really try to promote CBPR in multiple ways and foster. We do, I think Patrick put our website, thank you, up there on the chat a while ago or somewhere. So thanks for doing that. If anybody has follow-ups, feel free to be in touch with us. We'd be glad to say more.
And the only thing I want to add is that you notice the name is Detroit URC. It's not University of Michigan, Detroit URC. So again, thinking about power and thinking about reputation and thinking about who owns, the projects that are coming out of the Detroit URC. It's important as well in terms of naming things. So.
Okay. All right. So here's a question about one of the participants is working in a neighborhood called Brightmoor, which is in Detroit. And she says, or he says, many community partners have suggested that they had a lot of problems getting individuals engaged in the steering committee. We're doing some pre-evaluation to figure out why this might be. Some initial findings include concerns that all efforts will be for nothing in a year because people are concerned about gentrification and local governments undoing the hard work. There seems to be a level of passion for change, but also reluctance regarding preserving time and resources if more powerful leaders are going to undo this work. How would you suggest we move forward in a way that honors the community partners' concerns?
Great.
Wow.
Great question. Mm-hmm.
That's a tough one. I mean, I will raise the issue of one of the dynamics that are going on in the city of Detroit, as some folks may or may not know, is that it's really being gentrified. A lot of things are going on in the city that it's a two-edged sword. I mean, literally a two-edged sword. I grew up in Southwest Detroit. I went to high school in Southwest Detroit. You used to be able to buy a house in Southwest Detroit for probably $15,000 to $20,000. That same house now in that neighborhood, and the closer you are to the downtown area, which is known as Corktown, those houses are now, that same house that I just told you was if you paid $15,000, you're paying a lot. They're going for $250,000 to $300,000 because we're now the hot spot in the city. So I mean, it's difficult, and there has been little wanting to work collaboratively in that particular area because for multiple reasons. But it's a tough road to go, and I know exactly what you mean by you don't know who's going to be in a leadership role because there's just like it is throughout the country. You're either with me or you're against me. There's no middle road. There is no compromise. It is you're doing this. You're not supporting us, etc. So it's I mean I don't know what to tell you, frankly. Outside of if it had been handling a little bit differently from the beginning, it might have helped, but I don't know.
Yeah, I would say part of the CBPR process is allowing the community to identify what they would like to work on And it sounds like there's a misalignment. It's almost like you're talking to me about, wouldn't I like to learn more about playing lacrosse? But my basic needs, like I don't have food in the house, right? Like you're trying to support me in getting lacrosse equipment, but I don't have food in my refrigerator, right? So there's just a mismatch, it sounds like, between what the research interests are of the research partner and what the immediate concrete needs are that the community members are seeing. You have to figure out whether this is the right community or whether this is the right question or what. That's my gut reaction to that. If the pushback is, this is not the thing I care about, because that was in that question, right? That they don't seem to care, or why should I care? So I don't care about this thing. There's another thing I care about. So if you want to partner with me on working on this thing that I care about, then you might have a good group to work on that. But if this is your interest, then this may not be the community to engage with.
Great. And again, we don't know all the details, but I think the whole question about gentrification, if that's what's on people's mind, and they're reluctant to get committed into X because of Y, exactly what you're saying, Laprisha, maybe the focus needs to be on gentrification. And what are people's concerns about gentrification, and who else needs to be around the table from the mayor's office or whoever's office, whoever the developers are. But that may not be what the researcher wants to work on. And so, like you said, Laprisha, it may not be a good match.
Yeah. Okay. Thank you. All right. So here's another very interesting question. Can you expand a bit about repair, particularly when harm has happened historically with the partner institution as the site of power, historical harm, over-researched, etc.? How does one go about repairing that rupture in community?
You got to develop the trust again. The trust has been broken. So how do you develop that trust is the question. And the issue would be, you develop that trust by continually working. Again, we're back to the point of, and I think Laprisha and I both agree on, we're trying to point this out, is that you can't, not sure what I want to say. So let me pass it, because it's a tough one, but it's one of those things where you really have to, this is a long struggle. And it's as you continue working with a group or with individuals or a community or whatever it is, it'll come out in the wash, if you know what I'm saying. You will develop that trust again, because you can't overcommit. You got to follow through with what it is you're going to do. The worst thing you can do is try to come in and try to develop that trust again and then not do it. Just drop it, go, what are they called now? Ghost, where they get ghosted or something on the web. Come on, help me. I'm an old guy. I don't know this stuff. So they ghost people. They just, you don't know what's going on. So I think that's what's important is if you're not willing to do this for the long run, forget about it. I would recommend you don't do it. If you're willing to put in the time and the effort, and which may not be in the focus that you're looking at, that you want to research, then, it'll come. It'll come if you're willing to wait it, not wait it out, but work it out with the community so that they see that you're real.
I guess two things that I would add to what Ricardo just said. I often will have students ask me, how do I get communities to trust me? And I feel like it's the wrong question. I feel like, if you're not in and of the community, if you're coming in from outside the community, there's two things. One is that you need to demonstrate trustworthiness. You can't just ask people to trust you because you have good intentions or whatever. There has to be a demonstration of trustworthiness. And I really feel like unqualified trust is not the goal. So I think that you can develop a degree of trust. You can develop, enough trust so that you can raise the hard questions or have the hard communications or have the hard conversations. But to think that unqualified trust is a goal, I think is misplaced. Because I think mistrust is warranted. And that there always has to be a place for, let's have this conversation. And there may be things that I don't share with you for very good reasons. So I do think that I almost feel like, yes, trust to a degree is really important, and you have to have it in order to have, a real working relationship. But I think that a goal of unqualified trust is just not a reasonable goal. And I'm not even sure that it's a useful goal to have.
Thank you, Amy. Ricardo. Okay. Well, here's kind of a related question here. It is unfortunate, but not unheard of, for organizations to have explicitly stated values like power sharing and equal partnership, but implicit processes that are not in line. Do you have suggestions for how researchers and communities can hold themselves accountable to authentic partnership in specific ways? Perhaps a framework, a methodology, or something else? Thank you.
So, I'll take a stab at it. I'm probably oversimplifying, but in some ways, the framework, if you will, for the work that I do is the CBP, the community-based participatory research principles that we try to adhere to. And my guess is most people on this webinar are familiar with those. If you're not, we're certainly glad to share the ones that the Detroit Urban Research Center has its set. The work that Jeannie has done for a long time has their set, that they're often very similar. But the very things we've been talking about today, those core values, if you will, really guide the work that we do and could be seen as a framework. And so they are things like shared power and control, a co-learning and collaborative process, mutually beneficial. It's not just about research for research sake, but also about change and action and social issues around social justice, co-learning and capacity building, recognizing that we have a lot to learn from each other, and a lot of gained knowledge and skills from each other in the process. That it's a long-term commitment. Again, things that we've already talked about over the course of the last hour or so. I see them as ideals to strive for. Sometimes you go apropos to Amy's comment about trust, sometimes I feel like we do one step forward and two back, and then you hope you could do it one step forward and only one back. But that's the kind of, again, guidance and these ideals that we strive for in doing this work. So I don't know, others want to join in here, but that's what that question sort of prompted for me.
Yeah, I'm just going to raise something that Ricardo already said. Evaluating how things are going is a huge part of that. Amy and I were just in a meeting and we were reviewing the responses from evaluation, and I don't know how many folks actually responded, but there was one person that strongly disagreed that they felt comfortable speaking up during meetings. And I said to Amy, I'm not sure, this is my first time being part of this evaluation process with this group. And I said, well, she said, are there things we want to bring back to the larger group that we see here in the data? And I said, well, I'm not sure. It looks like there's one person that strongly disagreed. And Amy said, well, no, we want to talk about it then. If there's one person that felt like they didn't have, weren't able to speak out or say their opinion without feeling comfortable, then that's worth talking about. So evaluating how that relationship is going is really important. And then to Amy's point, if there's one person that is not feeling like the power is being shared, or feeling as engaged in the work, then it's worth a discussion and a new process, discussing a new process to make sure that that person feels engaged.
And then when you do the discussion, recognizing that there are people who don't feel comfortable like speaking up, you have to figure out ways to have that conversation that create a space for people to say what they may not feel comfortable saying, right? And so that's part of the real art of, the group dynamics. Like, how do you create spaces that are anonymous, or whatever it's going to take for people to say what it is they need to say in that context, so that you can at least have the conversation about it.
And not feel like they've been called out.
Yes, right.
I mean, if
Right.
it's one person, if
One
that one
person
person
in charge.
they're going, do I say that was me? You certainly know what we're trying to get to. So it's definitely tricky. Yeah.
All right. Okay, thank you. There are a couple of questions about sustaining intervention research that you're engaged in. Let me just read this one. Research projects have funding and staff support, but after the project ends, the community may not necessarily be able to find similar resources. Could you explain how your research teams might exit a community or end a research project and help communities build sustainable practices that align with the research project's purpose and mission?
Great question. I mean, Ricardo, I don't know if you want to say anything about Chaz and what you all were able to do.
Yeah, I don't mind. I think that I've already kind of touched a little bit on that one, but I think there are a couple dynamics that you really need to look at. Some grassroots organizations in communities fit that bill specifically in terms of they don't have the cash, they don't have the money, the ability to continue on with certain things. Other organizations, and I use ours, CHAS, had that ability because we were a larger organization. We had been around for a long time. We were trusted in the community. And one of the outcomes working with the university and the Urban Research Center was we became very legitimized, give me a better word, in terms of the funding community. Because we were participating in the research, it moved to a different level. We were looked at differently by the funding groups, and in particular at NIH, CDC, et cetera, some of the big money people. And we were looked at differently than we had in the past, where we really have to struggle with trying to figure out how we could get into that funding source at the national level. I think though that it's tough. I think that it's really, if this comes out of, if the issue that needs to be addressed comes out of the community, I think the community, as it proceeds and progresses, looking at that, realizes the funding issue is going to be, is going to be an issue, is going to be a problem, and will start addressing that themselves in collaboration, however, with the university folks, to see, well, what are we going to do afterwards? How are we going to be able to sustain this? In our particular case, we realized the importance of a couple of the programs, a couple of the research pieces that we did, and we made it part of our core services. They in turn, some of the smaller organizations may want to, again, we get into this collaboration, working with partnerships with other larger organizations in the community to be able to do some of the things. We were able to do that fairly successful with a couple of different programs where we ended up getting the dollars for it and contracting out to that community-based organization to continue to fulfill what it was they wanted to do, that they, well, not wanted to, but what they were doing. So it's really feasible, but I think now we're getting into the maturity of the program, of the groups that are working together in their ability to be able to do that. I mean, and it's not, that stuff does not happen the first couple of years, the first 3 years. Now, please understand that. What we're talking about now is the development of all of these trust issues, knowledge, et cetera, and folks knowing that you're real, that, you're going to fulfill what it is you're going to say, you're going to do what it is you say. So I think that's the important part.
So if I could just chime in, one of the things that the projects that I was responsible for as a research project manager, we always hired from the community. So it built some capacity in the community. So it may not be leaving the whole project, but you built some capacity in the community while you were there. So the idea is that there was value added to
Absolutely
the researcher being in that community, that it wasn't totally extractive. The other thing is we always close thinking about exiting a community. Not that the URC has exited the community, but when a project ends, there's always some community data dissemination that happens. So there's a rec center, there's a big meeting, everything's in plain language. The community can hear about the research results, and there are conversations about next steps. And there's an opportunity to put together partners that can carry on the work. So that's always been part of the strategies when a funded project is ending, to make sure, and we found that researchers are still willing to be engaged in some manner. Again, this is a marathon, not a sprint. And so the community understands how they can leverage some of those resources. But if nothing else, there has been capacity built within that community to do some of the pieces of work, right? We're not gonna have $5 million to do it again, but to do some pieces of that work. And that's really important.
Absolutely. That's a good point, because I mean, one of the things that the URC has been extremely successful in is being able to, we've created this whole group of community folks who are now data gatherers, survey takers, who are not just working with the URC or working in our communities, but are now engaged with other researchers at the university who are saying, well, what about that, that group that pulled together the information for a URC, project, so that they've got, jobs out of this, and skills that go on way past, what it is that we initially started. But in that pays dividends up the wazoo, in the community.
All right, thank you. I'm going to do one last question, and then we'll need to close. There are a couple of them that are addressing the notion of being gatekeepers. I think Laprisha, you raised that term first, but all four of you are gatekeepers, enlightened gatekeepers, certainly, and recognizing that this is a very tension-filled position. And so the question is, like, what are examples of some real concrete examples of stressors that are felt by gatekeepers during CBPR or in forming these partnerships?
Great question.
Yeah. I'd point out, we just kind of answered one with creating jobs. You're creating something in the community that wasn't there before. That really does, why am I going to get involved with this? Well, you're going to get a skill, you're going to, those kinds of things, and you're able to show folks something. Appreciate, let you jump in.
Yeah, so I'm thinking about stressors related to this, and Amy knows that we had some really intense conversations yesterday about power, and I actually, Amy doesn't know this, but I went off screen because I got really, really emotional, because I'm now sort of a leader in environmental justice work in Detroit, and I'm also a community member, and there was a community member that felt disregarded, disrespected, et cetera. And there were times that I felt like, wow, am I being a good enough support for this community member?
Yeah.
Am I somehow not taking that part of my responsibility where I need to take it? So self-care is really, really important in that role. And it can be really, really stressful. I didn't expect that to come out of that conversation. I thought, okay, I actually had talking points like, okay, I'm going to say these things and it's going to smooth everything over because I've had these types of conversations before, but it was just a really raw conversation. Everyone was feeling really, really vulnerable and it was just stressful, but we stayed at it. We had 2 meetings and we worked through it. And there were times that all of us were just silent because we didn't know what to say next. And I think people were fearful to say the wrong thing and right. And so it's just the reality of it. And so the only thing you really can do is practice some self-care, have some folks, hopefully not your family members to burden them with this stuff, but have other colleagues that you can talk through some of this stuff with, but you can't avoid being a gatekeeper and you can't avoid the stress that comes with it. So you just have to figure out ways to manage it and create some balance and work on some self-care. That's really all I have to offer, which is probably not the best answer, but.
Yeah, let me just throw one thing in. You can't fix everything. You do what you can do. You try to be able to work through some things. There are just some folks out there, whatever you want to do or you're expecting to do just won't happen. And it's okay. I mean, you kind of come to that point, says, well, Mrs. Garza, I'm sorry you feel that way, but we've done what we could, and there's nothing wrong with at some point, I'm not saying throwing up your hands and giving up, but it's just kind of acknowledging that you can't please everybody all the time. And, you just have to be able to, okay, well, let's move on. And we ran into that on many occasions with folks at the beginning where we were working with groups across the country with folks in Seattle, where we ran into a person who was just not happy. And we finally, I was burdened with having to deal with it. And I say burden is probably like bad term, but, just finally saying, hey, look, if you're not gonna be happy doing this and you don't want to do this, we've tried to do this, that, and the other, and it's not, nothing where we do. So adios. Sorry,
Yeah.
guys.
I know we're out of time. Just one real quick thing about the concept of gatekeepers. I always think about it, and for myself, is that, is the gatekeeper opening gates or is the gatekeeper closing gates? And I like to think that the role that I try to play is opening gates, but there are times when our community partners will say, we want you to vet academic researchers before you let them into the community, and that creates a tension. And again, it comes with the territory. It's something that it's an ongoing process. And I also want to point out the example Laprisha and Amy are referring to. I mean, this is happening in real time. So just to acknowledge that these partnerships don't, get establishing trust and love and all this kind of stuff once and for all. It's an ongoing process. It's an iterative process. And that's what makes it, to me, authentic. Because if you think about any relationships, in any partnerships, it's an ongoing process of establishing, maintaining, sustaining trust and caring, and etc. So it's the beauty and sometimes the beast.
Yes. Well, thank you. I hate to bring this to a close. There are a lot of remaining questions, and so sorry that we couldn't get to it, Patrick. I don't, this is the recording, and he'll get it to you. But I don't. Maybe we can show these questions that did not get addressed to the panelists and see how we can add that as well. All right. So Ed.
Thank you, Jeannie.
Ed, you're muted.
I just want to thank all 4 of the panelists and Jeannie for a wonderful hour and a half. It flew by. I just want to make one comment. I really learned to appreciate an aspect of this today. You all talked about authenticity and trust and continuity. And I think a mistake we sometimes make as academics is not to recognize that you really need to nurture the relationships and grow the relationships and not just focus on the project. And the last couple of comments that you all made really, I think, underscored that. So I think that's I thank you for that, accentuating that in my mind. So on behalf of the Community Peer Support Family Core of the Michigan Center for Diabetes Translational Research and the Curtis Center and the University of Michigan and the University of North Carolina, Chapel Hill, I want to, and the CHAS, the Community Health and Social Services Center, and the Detroiters Working for Environmental Justice, and the URC. Thank you for participating. We had over 80 participants, which is terrific for this kind of a program. So I want to thank all of those who contributed to it, and wish you all the best.